Hey everyone, it's Dr. Rick, founder of Herbal 411, and today is an unboxing on, well, this is just the UPS box, but it's an unboxing on peptides. Now, some of you have probably heard about peptides as this miracle kind of prescription, non-prescription medicine that's been available as of lately through either Amazon, which is kind of weird, but I'll explain why, or via your doctor's prescription pad with a compounding pharmacy. How can you get both? And you can. So let's just talk about what peptides are. Those of you who understand macronutrients, you'll know what amino acids are. Amino acids are basic building blocks for what everybody thinks of as muscle, but far more than that. Amino acids singly will be leucine, isoleucine, valine, and go down the line. Some of them are essential, some of them are non-essential, meaning that we can produce some, but we need to have some in our diet to make up the difference. Well, that's an amino acid. When you put amino acids together, you'll have a chain or a structure of some sort, and it'll be a combination of several amino acids. When you have 2 to up to 50 amino acids all together, they're called peptides. Typically, when you have more than that, you'll have a protein. And this is how the UPS box comes. And this is from South Lake Pharmacy. I just have to make sure my patient's name is not visible. Let's see, this is the fluid, the sterile bacteriostatic fluid that you mix in, saline most. And this is the component or the peptide. Now, as I mentioned, the world of peptides is deep, and there's multiple different peptides that are available out there for different things. But as I was alluding to, I can't talk about all of them. I'll just talk about the one that has made the biggest impact for my patients. Cover that up, but this is essentially what comes. And then this comes in the container. And the container has this. This is a vial. So BPC 157 is the topic of what I want to talk about today. This is a peptide. Now, it comes in this form. It's powder form, but you have to mix it in with the fluid that comes in here, and you make it active. And then you keep it in the fridge. I'm not going to open this because it's not mine. It's my patient's. But I wanted to take advantage of doing a video on this because I think it's giving great results. Going back to what a peptide is a bunch of amino acids, 2 to up to 50 all together. We have peptides in our body. The most common one that you probably know of is insulin. Insulin is usually made in the islets of Langerhans. That's in our pancreas. Those are little islands of cells, beta and alpha. And when you eat something, say you have your cereal. When your cereal gets digested, it goes into your stomach. The stomach acids break it down. The stomach senses, oh, this must be a solid. It's got these components. So it sends a message to the pancreas, which is right underneath the stomach. And the pancreas starts to secrete insulin, depending on the components of the macronutrients that made up your food source as it breaks down. It goes into the bloodstream, goes to the liver, and gets distributed into its areas where it's necessary to have. I just want to show you what happens when insulin, a peptide, is secreted from your pancreas. So when the pancreas senses from the stomach the signals that, hey, this meal that this guy ate is heavy with carbohydrates, then the pancreas starts to secrete insulin. Insulin gets released into the bloodstream to meet the food that's going to be churned and sent down to the small intestine for digestion. Well, when insulin in the bloodstream meets carbohydrates also absorbed and in the bloodstream, it works this way. Insulin is a molecule, a peptide, that floats around until it matches with a receptor on the cell. This is a cell. This is the membrane of the cell. That's just a container of an enzyme. And this insulin molecule comes around the bloodstream and it connects to this exact matchup receptor. When the receptor and the insulin molecule bind together, it releases a reaction inside the cell that turns on a container to release something that activates another enzymatic step that activates GLUT4. GLUT4 is something that's in the membrane that allows glucose to be taken into the cell. So if you didn't have insulin, you wouldn't release this activating enzyme that turns on GLUT4 so that you can absorb glucose. And if you don't have the insulin receptor because it's blocked, and you can't absorb glucose from the serum or blood into the cell, then you wind up being a diabetic because you have way too much glucose in the serum. That's when your blood glucose goes high. So typically when you have a meal that's heavy with glucose in its byproducts of being broken down, you have to take it out of the bloodstream and put it into the cell. That's the only safe way to protect the lining of the bloodstream, because the blood vessels are very sensitive and they get irritated with too much glucose. They get irritated with too much anything. And then you have the destruction of the lining that leads to plaquing and heart attacks and strokes and blood clots. So bottom line is that if you have a meal, it's heavy in glucose products, you have to immediately have the insulin secreted from the pancreas and the glucose taken out of the bloodstream into the cell, utilized and stored. And that's where, if it's a liver cell, it'll figure out where to put the glucose. It'll put it into glycogen, it'll put it into building blocks, proteoglycans. But bottom line is that if you can't get the glucose into the cell because GLUT4 is not being produced, assume that you're insulin resistant, and this insulin, even if it's being secreted at high levels, if you can't get the insulin to bind, then we have a problem. That's a peptide. Insulin's a peptide. So we make peptides. In some cases where you have type 1 diabetes and you don't make any insulin, you have to have the peptide injected. The beauty of peptides nowadays is that there's different peptides that accelerate or supplant what you can't have or what you can't make. You all know about insulin, and you probably have all heard about Ozempic or Wegovy for weight loss. Well, that's also a peptide. So you're being surrounded by peptides. PCSK9 you take to lower cholesterol twice a year. That's a peptide. Well, it's a peptide that's connected to a small molecule, but it's still braced by a peptide. So there's many, many uses for peptides. But the reason I wanted to talk about BP157 is that this peptide in particular has amazing Wolverine-like qualities to your exercise. If you have an injury and or if you aggressively exercise and you overtrain occasionally, you're going to wake up with soreness to the tendons, to the ligaments, to the muscles. Now, there's normal soreness that's expected with newbies that just begin exercise, or people that are very gifted with exercise, but they haven't been around for a while and then they start running again, like now. And that's why I wanted to do this video, is because it's going to turn from winter to spring, and everybody's going to start getting back to exercise again, whether they're running or cycling or rowing, or they're just getting ready for beach body weather. And sometimes as you get older, it's painful to get fine-tuned or initiate exercise again. So how do we get through it? We dose the exercises. We know. Some people don't know. So if you are commonly in the gym, you know, I'm not going to push too hard because it's going to hurt tomorrow. And you're going to walk like John Wayne, or that's what I say. John Wayne used to walk with a weird gait. And after doing leg day, it's like I have to walk around like that, or like Frankenstein. I think you probably all know Frankenstein. So the idea is that there's delayed onset muscle soreness that we all understand. But if you're a newbie, you probably don't, and you're going to push too hard because your brain will say, wait, I did that in high school, so I'm going to push just as hard my first day, and then you can't walk for a week. Then you're toast because it gets really discouraging. Or 2 weeks. Or if you work construction, you can't work. That's going to be painful. So the idea is that we have to dial in the amount of exercise that we initiate. Or if you're already exercising and you push too hard or you introduce something too aggressive, then you have to deal with the delayed onset muscle soreness. Sometimes in delayed onset muscle soreness, there are things that we can use as physicians to speed up the healing process. That would be muscle relaxants, anti-inflammatories if your blood pressure is okay. Other medicines, if you're a functional medicine doctor, you can use turmeric, you can use magnesium, you can use topical helichrysum. The bottom line is there's many things we can go to. This is fantastic as far as speeding up the healing process. So this peptide in particular has a very low LD50, meaning a lethal dose for 50% of the population. I think it's like 120 grams. But we honestly use, for my patients, about 300, maybe 500 micrograms per day subcutaneously. Sometimes I'll go more aggressive. It depends on the patient, depends on the age. We really won't have too many side effects. However, the action of BPC, again, as a peptide, is to increase angiogenesis. Angiogenesis is calling on blood vessels to develop faster. Think of a meniscus tear or a hip, an acetabular or a labral tear. Those things, sometimes in the wrong position in the joint, will be very difficult to operate or fix surgically. So the surgeons say, well, we're not going to do anything with it. We'll just watch it and go to physical therapy. And if you're stuck with a bad physical therapist, you'll not get anywhere. You'll probably have chronic pain or an unnecessary surgery that probably won't help you. But the important thing is, if you do the right rehab, if you have the right doc, and if you have already maximized on the medications, a little bit of turmeric, a little bit of anti-inflammatory, a little bit of muscle relaxer, sleep medicine, and pain control is necessary, then we can take advantage of BPC and accelerate your healing. So how does it work? Again, it works by, number one, turning on angiogenesis. So if you inject it subcutaneously around the area, so if I had an elbow problem inside the elbow, I'd inject it subcutaneously close to the elbow, and then use gua sha or skin scraping to get it to penetrate through and to be dispersed. There's an action where it gets liberated into the localized area where you inject it, and then it goes systemically. And it also gets absorbed into cells. It gets absorbed into the nucleus, and it turns on growth hormone receptors to be increased to express themselves around cell membranes, so that if there is growth hormone, and everybody should have growth hormone, and your cells will be more sensitized to the growth hormone you have already. So if you are super old like me, you probably don't have that much growth hormone. You might want to play around with that, but you should have enough growth hormone to effectively help you with healing. If you increase the receptors, think of it this way. If they have growth hormone, has the music, if you have better ears, bigger ears, then you can hear the music better and louder without turning up the volume too high. Well, that's growth hormone in a nutshell. You don't have to turn on growth hormone or take exogenous growth hormone. You just have to tell the cells to make more receptors, and then they'll take it up fast. If they take up growth hormone quickly, it goes into the nucleus, it repairs the cell faster, meaning the muscle. So that's the second business of how BPC 157 works. And by the way, that actually stands for Body Protective Compound, and it's 15 amino acids put together, and 7 refers to where in the cycle that the amino acids are strung, but that's not important. It's a weird name, but still, it is a component that we make in our own gastric acid or gastric juices. And if you don't make enough, then you take it. And anyway, as you get older, that always gets screwed up. And if you take Pepcid or omeprazole or Protonix or Prilosec, you're probably screwing that up as well. But bottom line is that you have this beautiful thing that's available for you from your doctor if he orders it or she orders it from a compounding pharmacy to speed up healing. And angiogenesis, increasing blood flow or blood vessel accumulation, turning on the receptor for growth hormone. And then finally, it does play around with cytokines. Cytokines are, if you remember the cytokine storm that killed patients that got COVID, well, if you throttle that storm, you can actually use it to a productive way to fix yourself and heal faster. So those are the 3 big mechanistic actions that BPC 157 has when you use it on your healing process. I have a lot of other people that I've heard that like to stack BPC 157 with another peptide called TB500. Those of you who know me, I'm functional medicine, integrative medicine, primary care. I am very picky. I like to do one thing at a time, because if I have a side effect, my thinking is that, and this is with all prescription medicines, if you do 5 different prescription medicines at a time, stacking, even microdosing, there's a chance that you might have a side effect, and I don't like that. So I like to do one thing at a time as long as the patient's not suffering, and then add the second thing, add the third thing, add another change in food, add another change in activity, change the sleep. I like to do all those things piecemeal, so that if there is a hiccup or a speed bump of some sort, I can blame it on one single component, instead of starting 5 to 10 things all at the same time and having a side effect, and I don't know which one caused a side effect. So I would use, and I do use BPC 157 first for anybody with musculoskeletal injury, and we see how things evolve. Theoretically, if you change around growth hormone receptor, if you change around angiogenesis, if you control cytokines, and have a specific storm to fix things, I think you'll speed up your healing process. Provided that you're eating properly, you're sleeping deeply, and you're also you're exercising, but you're not pushing the injury further. And I think a lot of patients or athletes that are out there will try to get this on their own, which you can. You can order this on Amazon, but I'd be very careful about where you get it from, or which, what are they called? bathtub pharmacist is putting this together in their own house, because there have been companies that supposedly check Amazon products, and LPS, or lipopolysaccharide, which is a byproduct of sepsis or bacteria. LPS has been found in some bootleg underground places that serve this stuff. So be very careful. I also think that most peptides will only be good in injectable form. There is one peptide, which is this one, BPC 157, which you can use in oral form, especially if you're a Crohn's disease sufferer. And it does work great with inflammatory bowel disease or Crohn's disease, because it gets into the stomach. This is the only one that tolerates stomach acid, and it gets through to the small intestine, and it helps the Crohn's sufferer. So I think it's great for the inflammation of Crohn's disease. I think it's great for the inflammation found in tendon tears, muscle soreness, muscle strain, tendon strains, ligament strains. And again, even in places that have poor vascularity, like a labrum in a hip, a meniscus in a knee, a labrum in a shoulder, usually what we do as sports medicine docs is we take steroids and inject them. And that does decrease the inflammation, but the steroid long term probably does a number on the rest of the components of the joint. So it slams inflammation quickly, but long term, I think it weakens the other components inside the joint. There's also PRP, plasma-rich platelets that you can take from your own blood, send it out to a company, they kind of clean it up, get the active ingredients, and you inject it back into the patient. And that's taking a concentrated amount of the patient's fluid, putting it in the joint so that it will also accelerate healing. So a lot of orthopedic surgeons will do that, but it's not covered by insurance, I don't think. And by the way, this is not covered by insurance either. But I would still say, if it facilitates or speeds up your healing process without any side effects, I think that would be great. The only problem is it's not covered by insurance. So I have found places that my patients that are members to my practice, I can give you the discount that I have, but it depends on the availability. It depends on what your problem is. It depends on how good you are with shots. But if you happen to be a patient, you can take advantage of this. All you have to do is have an injury, and then I evaluate, is this going to be good for you, or is it going to be TB500? Again, I usually start out with this to increase the vascularity to the area. And once the area is full of blood vessels, kind of like putting a warm compress on an old injury. It soothes and it causes blood flow to the area. If your blood is healthy, the blood brings healing fibroblasts, and the fibroblasts fix stuff. Well, if we can speed that up with BPC 157, I think that's fair. And you can use this IV, but I think it works better when you do it locally. And you do it usually you do it once a day, but the side effect, again, the lethal dose for 50% of the population is low. And I don't ever get close to that dose for a human. However, there is one side effect that I have to watch out for. And because it does increase angiogenesis and blood flow, you have to be careful that you don't have a hidden cancer, or you don't have an active cancer. And if you have an active cancer and or a tumor that's growing, and the angiogenesis that this causes and the growth hormone receptor that it stimulates can actually work on the cancer and increase or speed up the cancer. So you have to be careful with old people like me. You also have to be careful with people with high risk. For example, those of you who want to lose weight with semaglutide or Ozempic or Wegovy. Well, if you didn't know, that peptide works the same way. It's a peptide that we release in our small intestines. And if you get it in concentrated form, it actually slows down digestion. It keeps your stomach fuller for a longer amount of time. It gives you a little nausea. Thus, you don't want to eat anything. So it makes your restrictive dieting a lot easier to tolerate. But if you have any history of MEN cancers, multiple endocrine neoplasia cancers, that's usually adrenals, thyroid, and a couple other places, you have to be careful, because even Ozempic or Wegovy can turn that on too. That's the side effect of that peptide. So although they're great positive effects, there is one small side effect, and you have to be careful. But hopefully if you're exercising and following a pretty healthy practice or lifestyle, you're not going to be at risk for cancer of some sort forming. If you are, well, get your screening done with your doctor, and it just happens to be the first of the year, so all wellness visits are usually covered by insurance, including the blood tests or some blood tests. So get into your doctor's office, your primary care doctor's office, or your gynae, or your pediatrician. Get your annual wellness taken care of and move forward. Get a baseline for what's missing, what you're deficient with, or what could be causing your suffering, and then start to take care of those little things, those deficiencies, or those levers that you have to pull to get healthy now, before we get into spring and summer, when you can really take advantage of outdoor activities. I think sun always makes us feel healthy, but sometimes if you are injured, this will get you to reverse and get to healthy levels fast, so you can go back and engage more exercise in the proper way with the proper guidance. And if you don't have any guidance, you can be one of my patients. Just click the link down below and think about joining me, whether you're in the state of Illinois or outside the state or outside the U.S. I can usually help you or make some guidance suggestions. But if you are in the U.S., I can use some compounding pharmacies that send off to most states and hopefully take care of you that way as far as consulting for healthy changes. If you have any questions on how to use BP 157, or if you have used BP 157 injected or oral, please put them in the comments section down below. If you guys want to hear more about peptides, I'll be talking about TB500 soon and other ones for sleep and increasing mitochondria. But I thought this would be the easiest because all my guys are starting to get out and get injured, and this will speed it up. And if you don't know what to do as far as exercise or zone training, or if you think that you're healthy and you think that you're eating properly and you think that you have a great BMI, I'll help you figure that out. Because sometimes if you think all that stuff, but you haven't had a doctor look at you microscopically or intracellularly, you'll find stuff that you still have to fine tune. And by the way, when you find your cruising altitude as far as everything working, you got to be prepared for the next decade in life, because everything that worked at 20 usually doesn't work at 30. And same thing for 40 from 30, 50 from 40. So as you go forward, it's exciting to always anticipate change, anticipate a speed bump of some sort, but it's also exciting to anticipate it, recognize it, work with a team to fix it, and then move forward for the next decade. If we can get those decades all controlled as far as the challenges that usually meet us in each decade, then we can all get to like 80 or 90 and be independent and witness what happens with the world, with our grandkids, with our great-grandkids, or with our communities, and see, hopefully, humanity prosper, or be the Nidus or the people who fixed humanity. So hopefully this gave you a couple of ideas. If you have any questions, put them in the comment section down below. If you need a doctor, check out my link to my practice, or just be a YouTube subscriber, and I'll see you at the next video. Thanks for watching.